Welcome to another session of Ask the Expert. My name is Ben Lee, and I'm with the Bay Area Association of Kidney Patients, or BAAKP, an organization here in the San Francisco Bay Area dedicated to educating and supporting our local community's patients with chronic kidney disease. We're here today at Sourcewise, previously known as the Council on Aging of the Silicon Valley. We will be talking today with Marcelo Espiritu, the product analyst for their Health Insurance Counseling and Advocacy Program, also known as BAAKP. As a state-certified Medicare counselor, he has helped many people navigate their Medicare options and issues. BAAKP at Sourcewise receives many inquiries as well from people who have yet to obtain Medicare coverage, but are looking for other alternatives in the meantime. Marcelo is a graduate of St. Mary's College at Moraga, Cal Poly, and UC Berkeley. Welcome, Marcelo. Thank you for being with us.
Thank you, Ben. It's great to be here with you.
Now, we're here this time to talk about the Affordable Care Act, otherwise known as Obamacare, and specifically how Obamacare affects people with chronic kidney disease and also people on Medicare. Now, we know that every case is different and every patient is different. So we won't be able to address any particular topic specific to any one condition or any particular case. We'll be touched upon this subject in a fairly broad manner and cover different stages of kidney disease for people who are going through this process. First, we will talk about people who have been diagnosed with kidney disease but have yet to go on dialysis. Of course, second, we will talk about how Obamacare affects Medicare and people who are on Medicare and are being treated via dialysis. And lastly, we'll address some concerns perhaps about how this may affect people who have had kidney transplants and what effects that might be. So, with that structure in mind, Marcelo, thank you for being with us, but let's start off with an overview of the Affordable Care Act. And also to ask you a question that I'm sure are on many people's minds. What's this that I hear about all these problems with the healthcare exchange?
Right. So the Affordable Care Act, Ben, has many aspects to it, and in the news lately, we've been hearing about problems with the health exchange on healthcare.gov. Now, as you know, states are at liberty to create their own health insurance exchange or marketplace, and California did that right away. Our exchange is called Covered California, and we are not having the same problems that the federal exchanges are having in other states. In fact, we're enrolling, increasing enrollment daily.
That's great news. So just to clarify, the exchanges are essentially marketplaces for private insurance, is that correct?
That's correct.
Okay.
Marketplaces where one can go and compare different insurance plans. It's been very difficult in the past to compare plans and the benefits, but these exchanges offer a place for people to go and purchase plans that meet have essential benefits required by the ACA.
Oh, that's great. And Californians are not as affected by the healthcare exchange issues. Now, there are other elements of the Affordable Care Act, right? So what are some of the ones that affect, that are relevant to people with kidney disease?
Right. Well, first of all, one of the largest ones is the Affordable Care Act does away with pre-existing condition requirements. So people can no longer be denied insurance because of their medical history. Furthermore, there are no more lifetime maximums on what a plan can pay out on a person's benefits and services. And as you know, there are essential benefits that plans must meet going forward in 2014.
Mm-hmm. Okay. Now, I've been hearing in the news about people losing their health care coverage. How is that happening, and is that related to some of these levels of coverage that you're talking about?
Right. So people have received notices that their insurance will be terminated, and that's because they don't meet the minimum requirements that are outlined in the Affordable Care Act. So many plans and insurance policies were sold in the past that really weren't serving people well. If they had a particular emergency, well, sometimes the plans had exclusions for certain things, and the policies weren't up to snuff. And so these policies are being terminated. President Obama said it's up to the states to decide if they will allow plans like this to continue. But California and the exchange, Covered California Exchange, has said, no, you cannot continue selling these subpar plans.
I see. So then the alternative for people who may be affected by this would be then to go into the exchanges, to the Covered California Exchange. Is that correct?
That's right. Depending on what sort of situation they're in, as you mentioned, the Covered California Exchange is a new option for people.
Okay. Yes. Okay. So with that, let's switch over to talking about people who are not on dialysis yet. Now, this particular group of people have many forms of coverage. So without being able to go into in detail on any of these, let's talk broadly. So let's say that someone has kidney disease, have been diagnosed, but are not on Medicare. And for most people, they get their coverage through an employer program. What are some of the things they should be concerned about, if any, or if there are any benefits?
Right. So when one has coverage through their employer, and they're diagnosed, but without Medicare, well, that will continue. What's really interesting is that small business owners are being incentivized to provide insurance to their employees now through tax credits. And should one have that type of insurance, they can rest assured now that the small business insurance that they may have will coordinate with Medicare. This was recently announced, and it is really good news for people who may need dialysis or transplant in the future. But each employer is different, so I would recommend talking to your human resources department about what they plan for their insurance in the future.
Oh, that's great. Now you mentioned something, which is having the plan coordinate with Medicare. Can you describe a little bit more what that means in terms of coordination with Medicare?
Right. So when one is employed and has coverage, and one then becomes eligible for Medicare due to dialysis or needing a transplant, well, the employer coverage acts as the primary payer for the first 30 months. And after the 30 months, then Medicare takes over and becomes the primary payer, with one's employer picking up as the secondary payer.
Mm-hmm. I see, okay. So that makes an easier transition.
That's right. Now,
again, with a group of people who are not on dialysis yet, some of them may be self-insured. Maybe they have had their own coverage, not through an employer. Now, we've talked about removing lifetime caps and some of these benefits. How are they affected? Do some of the similar types of changes that are affecting the employer plan, does it apply to them as well?
Well, the plans, as you mentioned, they must meet those essential benefits. Mm-hmm. And if they don't, then in our state, they will be terminated, and one would then have to look for private insurance. Mm-hmm. The exchange is a terrific option for them. Mm-hmm. And they cannot be denied because of their medical history, and they can shop for a plan and have access that way to health coverage.
I see, okay. Now, we've heard in the news also that there will be subsidies available for people who are self-insured. Can you talk a little bit about that?
Sure. When subsidies for health insurance coverage from the federal government can only be obtained if one purchases insurance coverage through Covered California or through one of these exchanges. When one goes online, they enter only their zip code, the number of people in their household, mm-hmm. and their household income. And depending on that mix, people are eligible for premium assistance. Mm. So perhaps a bronze plan might cost a certain amount of money if their income is below a certain level. For example, a single person with an income lower than $45,000 960 would be eligible for a lower premium. Furthermore, if their income is much lower, at let's say $15,856 for a single person, then they would be moved into the Medi-Cal system and receive coverage through Medi-Cal.
I see. Now, this is very interesting because I see that there's an actual table of people's income versus the kind of subsidies they get.
That's right.
Is there a document that you can share with us later that we can post online?
Sure, yes.
Okay. Well, that's great news. Look for our website, www.baakp.org, where we have links to documents posted for that comes from this discussion, including some of this information that Marcellus had mentioned. Moving on a little bit more. Thank you, Marcella, for that. Now, in the past, I know that patients with chronic kidney disease have sought coverage under the MRMIP, or Mr. MIP, plan in California, which is for the major risk, people with pre-existing conditions, essentially. What is going to happen to the Mr. MIP program in California as a result of the Affordable Care Act?
That's a good question, Ben. As far as we know, Mr. MIP will continue, and they will still continue to accept applications, even from people who have Medicare ESRD, due to ESRD. So yes, as far as we know, it will continue in 2014. We haven't heard otherwise.
That's great news for people who may still be on Mr. MIP, at least to plan their transition.
Yes.
Do we know for sure what will happen, or is that still too far out?
It's still too far out. We're waiting to hear about what will happen with Mr. MIP beyond that time.
Thank you. Now, I think you alluded to this earlier, Marcelo, but there's also a cohort of people who have no insurance and who have very low incomes. I think you talked about Medi-Cal. Can you expand that on a little bit?
Sure. Another aspect of the Affordable Care Act is it's really to expand coverage of those who are uninsured. Currently, a large group of uninsured people are childless adults who are 19 to 64. And so what the Affordable Care Act did is it expanded Medicaid or Medi-Cal coverage in California to that population of childless adults. So people who have an income of 138% of the federal poverty level or below are now able to obtain Medi-Cal coverage.
That's great. So that's one final option for people with lower income then.
That's right.
Okay. Now, one last question before we move on to the next section, which is about people who are on dialysis, but we'll get to that. Now, for people who are over 65 and who are currently on Medicare and who have just received a diagnosis of chronic kidney disease, do these people have to do anything since they are currently on Medicare?
Well, if one's currently on Medicare, there are basically two paths or two places one could be. About 25% of the people on Medicare have, 25 to 30% have what's called a Medicare Advantage plan.
Okay.
These are, in our county, private HMOs that are approved by Medicare to give their enrollees the Part A and B benefits of Medicare. And they do not have to do anything.
Oh, okay, great.
And on the other hand, there are people who have what's called original or traditional fee-for-service Medicare. And if they are diagnosed with End Stage Renal Disease, then they do not have to do anything. Most of the people in that situation have supplemental coverage already, either through what's called a Medigap plan or through Medi-Cal that picks up secondary to Medicare, or maybe a retiree plan. So these people do not have to do anything. The problem, and as you know, are people who don't have a supplemental. They cannot pick up a Medigap plan once they are diagnosed with end-stage renal disease because pre-existing conditions can be used to evaluate people for these Medicare supplement insurance plans.
I see.
And they would be denied because of because of their pre-existing condition.
That's a very important point. So the removal of pre-existing conditions doesn't apply to Medicare private Medicare supplemental plans. Is that correct?
That's correct.
Okay. Now you mentioned other alternatives. So let's say that if you're denied because of pre-existing conditions for a private Medicare supplemental, could Medi-Cal be an option, I think you're saying?
Yes, so Medi-Cal could be an option. In the traditional fee-for-service cost structure, Medicare doesn't pay everything. It pays 80% and the beneficiary is responsible for 20%. One can have Medi-Cal to help pick up the 20% that the beneficiary is responsible for. Another alternative, if one does not qualify for Medi-Cal, is still the Mr. MIP program.
Which is still active, at least through 2014, that we know of.
That's right.
Great, okay. Well, thank you. That's very informative. Now, I want to move on to our next section, which is addressing people who are currently on dialysis, and followed by the transplant cohort group of patients. So, regarding dialysis, Marcelo, it's sort of assumed that if you're on dialysis, you're essentially on Medicare, right? How are dialysis reimbursements affected, if at all, by Obamacare?
Well, there are changes, but not really because of Obamacare. In 2008, there was the MIPA, Medicare Improvement for Patients and Providers Act. And what this did was change the way dialysis services were paid by Medicare. They created a bundled payment system. And this has been in effect for years now, and we are approaching the last year of putting this bundled payment system in place. But it really doesn't have anything to do with the Affordable Care Act.
Oh, that's a very important point. Thank you for bringing this up. So I want to clarify. Now, there have been dialysis patients who've expressed some concerns that the reimbursement methods and payments through the dialysis centers are changing right now. So what you're saying is that actually has been in play before the Affordable Care Act, and it's just part of the implementation process of that other law?
That's right. The law in 2008 that started the bundled payment system. And bundled payments, if they drop, well, the Medicare beneficiary is responsible for 20% of that. So should bundled payments and what Medicare says it will pay drops, so will the beneficiary's responsibility.
I see, okay.
As far as access goes, these centers have known about these changes for 4 years now and have been planning for it for a while. So we aren't anticipating access issues at this time.
So when you say access issues, I want to make sure we understand what access means. So when you say that access won't be affected, what do you mean by that?
Well, by that I mean if centers have a decrease in bundled payments, how it may affect supposedly what they can offer in terms of maybe how many people they can serve, or how they can expand or not.
Or it won't be a situation where instead of getting dialysis 3 times a week, I can only go twice a week. It's not going to be a situation like that, is it?
No, we don't see that.
Okay, you don't see that happening. Okay. And again, to clarify, when you say bundled payments for the dialysis centers, what do you mean by that?
Well, it's a group of services. Some services were paid by Medicare separately. And now with the bundled payment, then services are grouped together, and a bundled payment is given instead of by each separate service or medication.
I see. So, in other words, Medicare pays the dialysis center one lump sum. Is it per visit, probably, right? Well, without going into that, may be a little detailed, but it's essentially the dialysis center gets paid one lump sum for the dialysis service and the medications and everything that's included in that, right?
Yes.
Okay. Well, thank you. So essentially what I'm hearing is the dialysis patient will not be affected by Obamacare.
Right.
Oh, okay. Now, another portion of this, and this may be related to drugs, which is a topic later, is that there's been talk about the so-called Medicare Part D donut hole closing as part of Obamacare. Can you describe that a little bit and explain that in a little more detail?
Sure. It has to do with Medicare Part D outpatient drug coverage. And when this law and this benefit was started in 2006, people would pay for their prescription drugs at the pharmacy. And after a certain point in time, some people would hit what was called the donut hole, at which point they would be responsible for 100% of the drug coverage. Mm-hmm. Now, the way the structure is set up is that before one reaches the donut hole, they are responsible for 25% of the full cost of the drug or less. And the plan can do better by their beneficiaries if they want to. So when we say that the donut hole is closing, it is shrinking such that instead of paying 100% in the donut hole, they will pay what they would have been paying before the donut hole. 25% is what their responsibility will become, or less, as of 2020. Currently, there are discounts on brand name drugs in the donut hole. 52.5% this year for brand name drugs and 28% for generic drugs.
So in other words, if the medications that I'm taking are expensive enough that I'm somehow in this range where I'm responsible for 100%, and you said that this will be fully closed by 2020, I think what you're saying is that this donut hole is shrinking rather than closing completely, right?
That's right.
Is it a phase-in type of situation?
Yes, each year more discounts will apply to both brand and generic drugs, okay, until actuarially the responsibility of the beneficiary is 25% or less. Then and a plan can create their plan around those guidelines.
I see, okay. Yes. That actually essentially is part of the conversation related to patients who have already had their kidney transplant, obviously because there's a lot of post-transplant medications involved. And so that answers some of the questions that I have as far as prescription coverage for post-transplant. Do you know, in general, are there any other changes, particularly those, let's say, who have private insurance coverage and outside of the Medicare Part D, how they might be affected by the Affordable Care Act?
Right. So if we're looking at people who purchase insurance on the exchange, mm-hmm, qualified health plans, which can be purchased outside the exchange, mm-hmm, as well, it's just important to look at the formulary. And the formularies can't be found on the Covered California website. You have to go to the insurance plan itself, their website, and pick up a formulary and see which drugs are covered. I think that's a very important exercise, especially for those who have many medications to take, mm-hmm, like the population we're talking about now. The rate at which the person must pay is dependent on the plan one picks. So for example, a bronze plan, a person is responsible for, I think it's 30% or more of the cost of services or the drug. Mm-hmm. If you move up in metal, then let's say the gold plan, one's responsible for 20% of the cost of that medication. So that is how one, I think, might want to approach looking at drug coverage privately.
I see, okay.
Ask for the formulary.
Ask for the and so, just to clarify, the formulary is a list of medications that the insurance plan covers. Is that correct?
Right.
And would usually a formulary also tell you to what extent is the coverage?
Well, that would be the benefit plan.
I see, okay.
So
it sounds like people have to do their own research
to
their own plan, compare what's covered, plus the addition of the formulary, which I believe everybody's recommended to go to their own insurance plan's website. Is that essentially the advice?
That's right.
Okay.
Yes.
And then for those plans that are purchased on the healthcare exchanges, they will also have the formulary as well as the reimbursement rates, right?
Yes.
Okay. All right. Now, we've talked about the donut hole already. What other pharmacy considerations are there? I think we had talked a little bit before about some pharmacy management plans that the Affordable Care Act provides. Can you talk a little bit about those?
Right. So there's a program called Medication Therapy Management, and the Affordable Care Act actually strengthens this program. It hasn't been as widely utilized as they would have liked to have seen. Medication therapy management is for people with chronic conditions and a large number of prescription drugs that they're taking. So by asking for medication therapy management, one can consult with a pharmacist, either face-to-face or over the phone or online, over video, and get an evaluation of one's prescription drug medication list. Sometimes there are ways to optimize what one is taking, and this is a benefit that one should ask for if they do have chronic conditions and are in Medicare.
I see. So essentially what I think you're saying is that these programs allow you to help you design your medication regimen to look out for everything from drug interactions to redundant drugs. Is that essentially what's happening?
That's right.
Okay.
That's right. We've seen some people are very lucky. Their providers are looking out for the list of drugs. Sometimes in the other situations, people receive prescriptions from a variety of different doctors who don't communicate, and maybe they aren't quite sure what the full list is looking like at times. But it's always good to have another set of eyes looking at what one has to take.
Now, do I have to have one of these plans that I purchased through the exchange to get this pharmacy management plan, or should I ask for this regardless of what kind of plan I have?
Definitely, when it comes to Medicare, this is a benefit that I think our audience members could use. I'm not sure if the exchange has a medication therapy management benefit to it. I'd have to get back to you on that.
That's fine, but definitely if you have Medicare, look for this pharmacy management benefit. Okay, thank you. One last topic regarding transplants. Now, we know in the past that if you are on dialysis and on Medicare, that as soon as you get your transplant, Medicare will cover your anti-rejection medications for 3 years, after which you will have to resort to private insurance. Do we know, and this is maybe a little bit detailed, but do we know if that changes at all, or is that still the case?
No, it has not changed. There is legislation that is looking to change that. This is really one major gap in our health system that needs to change, I believe. People who have transplants under 65 are eligible for Medicare because of kidney disease, can only stay on it after, well, at 3 years it ends. Now, in the past, these people would not be able to get private insurance coverage. It would be difficult because they could be denied for a pre-existing condition.
And a kidney transplant is a giant pre-existing condition.
Exactly.
Okay.
And so it's great now they have an option. Okay. After they are taken off Medicare, they can purchase insurance on the exchange without fear of being denied.
Okay. And again, to clarify, this affects only those under 65, right? So if you're over 65, even after these 3 years, you can still use Medicare Part D for your anti-rejection medications. Is that correct?
Right.
Okay.
D, outpatient drugs, but you would also keep Medicare Part B, which pays for immunosuppressive drugs and many other, even chemo drugs. But Part B does cover that when you're over 65, and they do not have to worry about that type of coverage.
Okay.
going away. Like you said, it's for people under 65.
Okay.
But now they can have access to their drugs through health plans on the exchange.
Okay, that's great news. So let's wrap up with some final thoughts. Now that we've covered some of these major areas for kidney disease, there's been a lot of information that we've gone over here, and I'm sure there are quite a number of links. If you can provide us with some of those links, we'll make sure that they get posted onto our website, www.baakp.org. If you're watching this program on our website, I'm sure you'll be able to find the links, point you to them. Lastly, Marcelo, what are some of the important dates, given that we are in mid-November, with respect to the Affordable Care Act?
Right. So an important date to remember is December 14th, because that is actually the last day you can apply and have your coverage effective on January 1st. If you were to submit an application after December 14th, then you would have your coverage effective in February. Of course, the enrollment period has been extended through March for the exchange, where again, effective dates of coverage are not the month after. It depends if you enroll before the 15th or after the 15th.
Mm-hmm.
So that is an important date.
Okay, so everyone should do their best if they want coverage through the exchanges to go to Covered California. The website name is coveredcalifornia.org, is that correct?
It's coveredcalifornia.com.
My mistake. Coveredcalifornia.com is where California should go and to investigate this.
That's right.
And December 15th, right?
December 14th.
14th, excuse me.
Last day to enroll.
Last day to enroll, okay. The other thing that we had read about in the news is that there are such people who are trained as quote-unquote navigators to help people figure out this whole complex thing that we're talking about here. How would I get in touch with a healthcare Obamacare navigator?
Right, so the best place to go is back to coveredcalifornia.com. If you look at the bottom of the home screen on the right, there's a button that says Find Help Near You. If you click on that button, you enter your zip code and a list and also a radius range around you to find out where the certified educators are who you could talk to. For example, you can go to various community health clinics. You can go to Social Services Administration. You could go to SCIU, the local union. There are many organizations, and that is the most comprehensive list on the coveredcalifornia.com website.
Great. Well, Marcelo, you've covered all of the major areas for chronic kidney disease, and I want to thank you very much. I really appreciate you taking your time to be with us. Thank you again for such great information. And
it's been a pleasure, man. Thanks for having me.
Likewise. And thank you again for joining us for such an informative session of Ask the Expert. We really appreciate you being with us today, and I hope you learn a great deal. Make sure to come to our website, www.baakp.org, where you'll find a lot of very informative links to the topics that we've talked about today. Also, please make sure to sign up for our discussion forum. We have a discussion forum on our website where other patients and members of the BAAKP discuss all kinds of topics, including additional information related to the topic of the Affordable Care Act that we talked about today. So please check us out at our website, and don't forget to go to the forum. And check back again for the next scheduled session of Ask the Expert. Thank you very much, and hope to see you soon.